Question 1. Process analysis reveals a patient undergoing an ambulatory surgical procedure has a documented history of opioid sensitivity. Following the procedure, the patient reports moderate pain. Which of the following approaches best aligns with best practices for perianesthesia patient care in this situation? Option A. Initiate a non-opioid multimodal pain management strategy, including scheduled acetaminophen and or NSAID, and consider adjuvant therapies as appropriate for the procedure and patient. Option B. Rely solely on the patient's reported pain score to initiate opioid therapy without further assessment or exploration of alternatives. Option C. Administer a standard opioid analgesic as prescribed for moderate pain, as the patient's current pain level warrants intervention. Option D. Discharge the patient with a prescription for, as needed, opioid medication to manage any breakthrough pain. Correct answer is A. Initiate a non-opioid multimodal pain management strategy, including scheduled acetaminophen and or NSAID, and consider adjuvant therapies as appropriate for the procedure and patient. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a patient with a history of opioid sensitivity, requiring careful assessment and management of pain post-operatively in the ambulatory setting. The perianesthesia nurse must balance the patient's need for pain relief with the risk of adverse reactions, necessitating a nuanced approach that prioritizes safety and evidence-based practice within the CAPA scope. Correct approach analysis. The correct approach represents best professional practice by prioritizing a non-opioid multimodal pain management strategy. This aligns with current evidence-based guidelines for ambulatory perianesthesia care, which advocate for minimizing opioid use due to risks of nausea, vomiting, sedation, respiratory depression, and potential for opioid-induced hyperalgesia, especially in opioid-sensitive individuals. The use of scheduled non-opioid analgesics, e.g., acetaminophen, NSAID, and potentially adjuvant therapies, e.g., gabapentinoids if indicated and appropriate for the procedure, addresses pain effectively while mitigating opioid-related risks. This approach is ethically sound, promoting patient well-being and minimizing harm, and is consistent with the CAPA standards of practice which emphasize safe and effective patient care. Incorrect approaches analysis. Administering a standard opioid analgesic without further assessment or modification fails to acknowledge the patient's documented opioid sensitivity. This approach poses a significant risk of an adverse reaction, violating the ethical principle of non-maleficence, do no harm, and potentially contravening institutional policies and CAPA guidelines on safe medication administration. Relying solely on patient-reported pain scores to initiate opioid therapy without considering the patient's history or exploring non-opioid alternatives overlooks the importance of a comprehensive pain assessment and management plan. This reactive approach can lead to unnecessary opioid exposure and potential complications, demonstrating a failure to adhere to best practices in perianesthesia pain management. Discharging the patient with only a, as needed, opioid prescription without exploring or attempting non-opioid alternatives first is a missed opportunity to optimize pain control and minimize opioid exposure. This approach may lead to increased opioid consumption and associated risks, and does not reflect a proactive, patient-centered pain management strategy that is expected in ambulatory perianesthesia care. Professional reasoning. Professionals should employ a systematic approach to pain management in the perianesthesia setting. This involves a thorough preoperative and postoperative assessment, including a detailed history of allergies, sensitivities, and previous responses to analgesics. Based on this assessment, a multimodal pain management plan should be developed, prioritizing non-opioid analgesics and adjunctive therapies whenever possible. The plan should be individualized to the patient's specific needs, procedure, and risk factors. Continuous reassessment of pain and the effectiveness of interventions is crucial, with a clear protocol for escalating care or modifying the plan if pain is not adequately controlled or if adverse effects occur. This decision-making process emphasizes patient safety, evidence-based practice, and ethical considerations. Question 2. Risk assessment procedures indicate that a patient recovering from a short outpatient surgical procedure under general anesthesia is exhibiting a sudden and significant drop in blood pressure and a concurrent increase in heart rate. The patient is alert but appears pale and diaphoretic. What is the most appropriate immediate nursing action? Option A. Continue to monitor the patient's vital signs every 15 minutes and document the findings, assuming it is a normal recovery variation. Option B. Administer a prescribed dose of a vasoconstrictor medication from the unit's emergency cart without consulting the anesthesia provider. Option C. Encourage the patient to take deep breaths and reposition them in a more comfortable position to improve circulation. Option D. Immediately notify the anesthesia provider of the patient's vital signs and clinical presentation, and prepare to administer intravenous fluids as ordered. The correct answer is D. Immediately notify the anesthesia provider of the patient's vital signs and clinical presentation, and prepare to administer intravenous fluids as ordered. Explanation. Scenario analysis. This scenario presents a common challenge in perianesthesia care, where a patient's physiological response to anesthesia deviates from the expected norm, potentially impacting their safety and recovery. The professional challenge lies in accurately interpreting the patient's signs, understanding the underlying causes, and implementing timely, evidence-based interventions to mitigate risk. The perianesthesia nurse must balance immediate clinical needs with adherence to established protocols and the patient's overall well-being, all within the context of ambulatory care where rapid recovery and discharge are often goals. Correct approach analysis. The correct approach involves a systematic, evidence-based response that prioritizes patient safety. This includes immediate assessment of vital signs and patient status, consultation with the anesthesia provider to determine the cause of the deviation, and implementation of interventions as ordered and per perianesthesia nursing standards of practice. This aligns with the core principles of patient safety and quality improvement, emphasizing prompt recognition of adverse events, effective communication, and appropriate clinical management to prevent harm. The CAPA certification emphasizes the nurse's role in monitoring, assessing, and intervening in the perianesthesia period, ensuring adherence to best practices and regulatory guidelines for patient care. Incorrect approaches analysis. One incorrect approach would be to delay reporting the change in vital signs to the anesthesia provider, assuming it is a transient fluctuation. This failure to promptly communicate critical patient information violates ethical obligations and regulatory requirements for timely assessment and intervention, potentially leading to delayed treatment and adverse outcomes. Demonstrates a lack of adherence to established perianesthesia protocols for monitoring and reporting. Another incorrect approach would be to independently administer medications or alter the patient's care plan without consulting the anesthesia provider or following established protocols. This oversteps the scope of practice for a perianesthesia nurse and bypasses the collaborative decision-making process essential for patient safety. It represents a significant regulatory and ethical failure, potentially leading to medication errors or inappropriate treatment. A third incorrect approach would be to focus solely on documenting the event without taking immediate action or seeking appropriate consultation. While accurate documentation is crucial, it is secondary to the immediate need for clinical intervention and assessment to ensure patient safety. This passive approach fails to meet the professional responsibility of actively managing a patient's care and mitigating potential harm. Professional reasoning. Professionals should employ a structured approach to patient care, often guided by mnemonics or established protocols such as ABC's airway, breathing, circulation, or similar frameworks for rapid assessment. Critical thinking involves analyzing the presented data, vital signs, patient presentation, considering potential causes for the deviation, and prioritizing interventions based on their potential impact on patient safety. Effective communication with the anesthesia provider and other members of the healthcare team is paramount. Adherence to institutional policies, perianesthesia nursing standards of practice, and regulatory guidelines, such as those implicitly tested by CAPA, forms the foundation for safe and effective patient care. Question 3. Benchmark analysis indicates that ambulatory perianesthesia nurses are increasingly facing time pressures to optimize patient throughput. A surgeon, preparing to take a patient to the operating room for a minor procedure, verbally requests the administration of a pre-anesthetic medication to a perianesthesia nurse. The nurse notes that, while the surgeon is well known and the procedure is routine, the patient's chart is not yet fully complete, with a few routine preoperative orders pending verification and a consent form that appears to have a minor clerical error in the patient's date of birth. The nurse has not yet performed a full preanesthesia assessment on this patient, What is the most appropriate course of action for the perianesthesia nurse to uphold the standards of practice in perianesthesia nursing? Option A. Administer the pre-anesthetic medication as requested by the surgeon, assuming the surgeon has completed their necessary checks and the minor chart discrepancies will be resolved later. Option B. Politely inform the surgeon that the pre-anesthetic medication cannot be administered until the patient's chart is fully complete, all orders are verified, and the consent form is corrected, and then proceed with a thorough pre-anesthesia assessment. Option C. Proceed with administering the pre-anesthetic medication based on the surgeon's verbal request, as the surgeon is a trusted colleague and the procedure is considered minor. Option D. Administer the pre-anesthetic medication immediately to avoid delaying the surgical schedule, and then complete the pre-anesthesia assessment and chart verification afterward. The correct answer is A. Administer the pre-anesthetic medication as requested by the surgeon, assuming the surgeon has completed their necessary checks and the minor chart discrepancies will be resolved later. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the perianesthesia nurse to balance patient advocacy, adherence to established standards of practice, and the practical realities of a busy ambulatory surgical center. The nurse must recognize the potential for patient harm if established protocols are bypassed, even under pressure. The core challenge lies in upholding the highest standards of care when faced with time constraints and the desire to facilitate efficient patient flow. Correct approach analysis. The correct approach, which involves a thorough pre-anesthesia assessment and verification of all necessary documentation and patient readiness before administering any medication, represents best professional practice. This aligns directly with the standards of practice in perianesthesia nursing, which mandate a comprehensive assessment to identify potential risks and ensure patient safety. Specifically, it upholds the principle of patient assessment and the right to safe, competent care, as outlined by professional nursing organizations and regulatory bodies governing nursing practice in the U.S. Failure to conduct a complete assessment before medication administration violates the fundamental ethical and legal duty to provide care that is based on a thorough understanding of the patient's condition and needs. Incorrect approaches analysis. One incorrect approach involves proceeding with medication administration based on the surgeon's verbal request without completing the full pre-anesthesia assessment and verifying all required documentation. This is a significant regulatory and ethical failure. It bypasses critical safety checks designed to prevent medication errors, adverse drug reactions, and to ensure the patient is appropriately prepared for anesthesia. This action directly contravenes the standards of practice that require a comprehensive assessment and verification of orders before initiating care. It also violates the principle of professional accountability, as the nurse is responsible for the safe administration of medications, not solely for following a verbal order without due diligence. Another incorrect approach is to administer the medication based on the assumption that the surgeon has already completed all necessary checks. This is a failure of professional vigilance and accountability. While collaboration with the surgical team is essential, the perianesthesia nurse has a distinct and independent responsibility to ensure patient safety. Relying on assumptions rather than direct verification is a breach of the standards of practice and can lead to serious patient harm. It demonstrates a lack of critical thinking and a failure to adhere to established protocols designed to mitigate risk. A third incorrect approach is to delay the medication administration significantly due to minor, unverified discrepancies in the chart, thereby impacting the surgical schedule. While patient safety is paramount, an excessive delay without clear justification or communication with the surgical team can also be problematic. However, the primary failure in this context is not the potential delay itself, but rather the implication that patient safety checks might be compromised to avoid such a delay. The standards of practice emphasize a balance between efficiency and safety, but safety must always take precedence. If the discrepancies are significant and pose a risk, delaying administration is the correct course of action, and the focus should be on efficient resolution of the discrepancies rather than compromising the assessment. The failure lies in prioritizing schedule over safety, which is a direct violation of ethical and professional obligation. Professional reasoning. Professionals should employ a systematic decision-making process that prioritizes patient safety above all else. This involves 1. Recognizing the standards of practice and regulatory requirements for pre-anesthesia assessment and medication administration. 2. Critically evaluating the situation, identifying potential risks and deviations from protocol. 3. Advocating for the patient by ensuring all safety checks are completed. 4. Communicating effectively with the surgical team to resolve any issues promptly and collaboratively. 5. Documenting all assessments, interventions, and communications accurately. This structured approach ensures that patient care is delivered in a safe, ethical, and legally compliant manner. Question 4. The efficiency study reveals that the average time spent on perianesthesia patient assessments is exceeding targets, prompting a discussion about streamlining the process. As a certified ambulatory perianesthesia nurse, CAPA, what is the most appropriate response to ensure patient safety and regulatory compliance while acknowledging the need for operational efficiency? Option A. Delegate portions of the pre-anesthesia assessment, such as reviewing medication lists or vital signs, to unlicensed assistive personnel to expedite the process. Option B. Rely solely on the electronic health record for all assessment data, assuming it is complete and accurate without independent verification by the perianesthesia nurse. Option C. Reduce the depth of the patient interview and physical assessment, focusing only on immediate pre-anesthesia concerns to meet the time targets. Option D. Implement a standardized checklist that guides the perianesthesia assessment, ensuring all critical elements are addressed consistently and efficiently, while allowing for professional judgment to address individual patient needs beyond the checklist. The correct answer is D. Implement a standardized checklist that guides the perianesthesia assessment, ensuring all critical elements are addressed consistently and efficiently, while allowing for professional judgment to address individual patient needs beyond the checklist. Explanation. This scenario is professionally challenging because it requires the perianesthesia nurse to balance the demands of efficiency with the paramount responsibility of patient safety and adherence to established perianesthesia nursing standards. The pressure to reduce turnaround times, while a common operational goal, must never compromise the thoroughness of the perianesthesia assessment or the nurse's professional judgment. The perianesthesia nurse's role is multifaceted, encompassing assessment, planning, intervention, and evaluation, all within a framework of regulatory compliance and ethical practice. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized patient assessment that aligns with the standards of perianesthesia nursing as defined by professional organizations and regulatory bodies governing nursing practice in the United States. This includes a thorough review of the patient's medical history, current condition, anesthetic plan, and potential risks, ensuring that all necessary pre-anesthesia interventions are completed and documented. This approach upholds the nurse's professional accountability and commitment to providing safe, high-quality patient care, directly addressing the core competencies expected of a certified ambulatory perianesthesia nurse, CAPA. Adherence to these standards is often mandated by state boards of nursing and accreditation bodies. An incorrect approach that bypasses or significantly abbreviates the perianesthesia assessment to meet efficiency targets would represent a failure to adhere to professional nursing standards and potentially violate regulatory requirements for patient assessment and care. This could lead to missed critical information, delayed identification of contraindications to anesthesia, or inadequate preparation for the procedure, all of which compromise patient safety and could result in adverse patient outcomes. Such an approach would also fail to meet the ethical obligation of beneficence and non-maleficence, as well as the professional standard of care expected in perianesthesia nursing. The professional reasoning process in such situations should involve a clear understanding of the perianesthesia nurse's scope of practice, the specific protocols and policies of the healthcare facility, and the relevant regulatory guidelines. When faced with conflicting pressures, the nurse must advocate for patient safety, utilizing critical thinking to evaluate the potential risks and benefits of any proposed change in practice. This involves clear communication with the interdisciplinary team, including physicians and anesthesia providers, to ensure that patient care decisions are collaborative and evidence-based, prioritizing safety and quality over arbitrary efficiency metrics. Question 5. Strategic planning requires a perianesthesia nurse to critically evaluate the completeness and accuracy of a patient's medical history. When faced with a patient presenting for ambulatory surgery with a history of a severe allergic reaction to a medication documented in their chart, but the patient states they have no known drug allergies, which approach best ensures patient safety and regulatory compliance? Option A. Conduct a thorough interview with the patient and their legal representative, cross-referencing their reported history with the documented allergy, and communicate any discrepancies to the anesthesia provider for further evaluation and management. Option B. Accept the patient's statement that they have no known drug allergies and disregard the documented allergy, assuming it was a past error in the medical record. Option C. Rely solely on the documented allergy in the patient's chart, as it is official medical record, and proceed with the pre-anesthesia assessment without further questioning the patient about this specific issue. Option D. Briefly ask the patient if they have any allergies, and upon their denial, consider the history complete without further investigation into the discrepancy with the chart. The correct answer is A. Conduct a thorough interview with the patient and their legal representative, cross-referencing their reported history with the documented allergy, and communicate any discrepancies to the anesthesia provider for further evaluation and management. Explanation. This scenario is professionally challenging because the perianesthesia nurse must synthesize information from multiple sources, some of which may be incomplete or contradictory, to ensure patient safety during the perioperative period. The CAPA certification emphasizes the importance of a comprehensive medical history for identifying potential risks and developing an individualized anesthesia plan. The nurse's judgment is critical in determining the significance of each piece of information and how it impacts patient care. The correct approach represents best professional practice because it prioritizes obtaining a complete and accurate medical history directly from the patient or their legal representative, supplemented by available documentation. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Regulatory frameworks, such as those governing nursing practice and patient rights, mandate that healthcare providers gather sufficient information to provide safe and effective care. Specifically, the American Society of Perianesthesia Nurses, ASPAN standards for post-anesthesia nursing care, and the American Nurses Association ANA Code of Ethics underscore the nurse's responsibility to assess patients thoroughly, which includes obtaining a detailed history. This approach ensures that all relevant factors, including allergies, previous anesthetic experiences, comorbidities, and current medications, are considered, thereby minimizing the risk of adverse events. An incorrect approach that relies solely on a brief, preoperative checklist without further inquiry fails to meet the standard of care. This is a regulatory failure because it neglects the comprehensive assessment required by nursing practice acts and professional standards. Ethically, it violates the principle of patient advocacy by not ensuring all potential risks are identified. Another incorrect approach that dismisses a patient's reported symptom as insignificant without further investigation is also a significant failure. This demonstrates a lack of critical thinking and can lead to overlooking serious underlying conditions, directly contravening the principle of non-maleficence and potentially violating patient safety regulations. Lastly, an approach that prioritizes speed over thoroughness, assuming all necessary information is already documented, is a dangerous shortcut. This disregards the dynamic nature of patient health and the potential for crucial details to be missing or misinterpreted in existing records, leading to a breach of professional responsibility and regulatory compliance. Professional decision-making process for similar situations involves a systematic approach. 1. Recognize the critical importance of a comprehensive medical history for perianesthesia care. 2. Prioritize direct patient or representative interview as the primary source of information. 3. Utilize available documentation e.g. physician's notes, previous records as supplementary information, critically evaluating its completeness and accuracy. 4. Employ critical thinking to identify potential risks and discrepancies. 5. Document all findings meticulously. 6. Communicate any concerns or identified risks to the anesthesia provider promptly. This process ensures adherence to regulatory requirements and ethical obligations for patient safety. Question 6. Process analysis reveals a post-operative ambulatory surgical patient reports moderate pain at the surgical site, yet their vital signs, blood pressure, heart rate, respiratory rate, and oxygen saturation are all within normal limits for the patient's baseline. The perianesthesia nurse is considering how to best manage this situation. Which of the following approaches best reflects current perianesthesia nursing best practices and regulatory expectations for patient care? Option A. Administer an appropriate analgesic based on the patient's reported pain intensity and location, and reassess pain after intervention. Option B. Reassure the patient that their vital signs are stable and suggest the pain is likely a normal, expected sensation that will resolve without medication. Option C. Document the patient's pain report but defer analgesic administration until vital signs deviate from normal parameters. Option D. Focus solely on the normal vital signs as the primary indicator of patient well-being, and conclude that no immediate intervention for pain is necessary. The correct answer is A. Administer an appropriate analgesic based on the patient's reported pain intensity and location, and reassess pain after intervention. Explanation. Scenario analysis. This scenario presents a common challenge in perianesthesia nursing, where a patient's subjective report of pain conflicts with objective vital signs. The professional challenge lies in accurately assessing and managing pain, while adhering to established perianesthesia nursing standards and patient safety protocols. It requires a nuanced understanding that pain is a subjective experience, and that vital signs alone are not always definitive indicators of pain intensity or distress. Correct approach analysis. The correct approach prioritizes the patient's subjective report of pain and utilizes a comprehensive assessment to guide interventions. This aligns with best practices in perianesthesia nursing, which emphasize patient-centered care and the recognition of pain as the fifth vital sign. The CAPA certification framework, and by extension, the standards of perianesthesia nursing practice in the U.S., mandate that nurses assess and manage pain effectively. This includes believing the patient's report, performing a thorough pain assessment, location, quality, intensity, timing, aggravating/alleviating factors, and intervening based on this assessment, rather than solely relying on objective data that may not fully capture the patient's experience. This approach upholds ethical principles of beneficence and non-maleficence by ensuring the patient receives appropriate pain relief and avoids unnecessary suffering. Incorrect approaches analysis. One incorrect approach focuses solely on the absence of abnormal vital signs. This fails to acknowledge the subjective nature of pain and can lead to undertreatment, violating the ethical principle of beneficence. Regulatory guidelines for perianesthesia nursing emphasize that pain management is a critical component of care, and ignoring a patient's reported pain based on normal vital signs is a deviation from these standards. Another incorrect approach involves delaying intervention until vital signs become abnormal. This approach is reactive rather than proactive and can result in prolonged patient suffering, which is contrary to the goal of providing comfortable and safe recovery. It also fails to meet the standard of care for timely pain management, potentially leading to complications associated with uncontrolled pain. A third incorrect approach might involve dismissing the patient's pain as a normal part of recovery without further assessment. This demonstrates a lack of empathy and a failure to conduct a complete pain assessment, which is a fundamental perianesthesia nursing skill. Such an approach can erode patient trust and lead to inadequate pain management, contravening ethical obligations to provide compassionate care. Professional reasoning. When faced with a discrepancy between subjective patient reports and objective data, perianesthesia nurses should employ a systematic decision-making process. This involves 1. Acknowledging and validating the patient's subjective experience. 2. Conducting a comprehensive assessment that includes both subjective pain assessment tools and objective vital signs, wound assessment, etc. Data. 3. Correlating findings, understanding that subjective reports often take precedence in pain management. 4. Implementing appropriate interventions based on the comprehensive assessment and established protocols. 5. Reassessing the patient's response to interventions and adjusting the plan of care as needed. This iterative process ensures patient safety and optimal recovery. Question 7. Process analysis reveals a 55-year-old male patient with a documented history of moderate obstructive sleep apnea, OSA, managed with a CPAP machine at home, is scheduled for a laparoscopic cholecystectomy under general anesthesia. The patient has no other significant comorbidities and is ASA class Roman II. During the intraoperative period, which of the following monitoring strategies would be most critical to ensure the patient's airway patency and adequate ventilation, given his OSA diagnosis? Option A. Intermittent manual assessment of respiratory rate and depth every 15 minutes. Option B. Continuous capnography and pulse oximetry. Option C. Continuous pulse oximetry with periodic arterial blood gas sampling. Option D. Continuous non-invasive blood pressure monitoring and electrocardiography. The correct answer is B. Continuous capnography and pulse oximetry. Explanation: scenario analysis. This scenario presents a common challenge in ambulatory perianesthesia settings, managing a patient with a known history of obstructive sleep apnea, OSA, undergoing elective surgery. The professional challenge lies in anticipating and mitigating the increased risk of intraoperative respiratory compromise due to the effects of anesthesia and sedation on airway patency and respiratory drive, especially in a setting where continuous, high-acuity monitoring might be less readily available than in an inpatient operating room. Careful judgment is required to select appropriate monitoring strategies that balance patient safety with the efficiency of ambulatory care. Correct approach analysis. The correct approach prioritizes continuous, direct monitoring of ventilation and oxygenation, recognizing the heightened vulnerability of patients with OSA. Capnography is the gold standard for assessing ventilation, providing real-time data on end-tidal carbon dioxide (ECO2) and respiratory rate. This allows for immediate detection of hypoventilation or apnea, which are critical concerns in OSA patients. Pulse oximetry complements this by monitoring oxygen saturation. The CAPA certification framework emphasizes evidence-based practices and patient safety, and the American Society of Anesthesiologists, ASA guidelines, which are foundational to perianesthesia nursing practice in the U.S., strongly recommend capnography for all patients receiving moderate sedation or general anesthesia, with particular emphasis on those with risk factors like OSA. This approach directly addresses the physiological risks associated with OSA and anesthesia, aligning with the CAPA scope of practice to provide safe and effective perianesthesia care. Incorrect approaches analysis. One incorrect approach would be to rely solely on intermittent manual assessment of respiratory rate and depth. This is professionally unacceptable because it is subjective, prone to human error, and fails to provide the continuous, objective data necessary to detect subtle but critical changes in ventilation, especially in a patient with OSA whose airway is prone to collapse. This approach violates the principle of diligent monitoring and the regulatory expectation for objective assessment of respiratory status, as outlined in perianesthesia nursing standards of practice. Another incorrect approach would be to only monitor oxygen saturation via pulse oximetry. While pulse oximetry is important, it is a lagging indicator of respiratory compromise. Significant hypoventilation can occur before a clinically significant drop in oxygen saturation is detected, particularly in patients with OSA who may have underlying chronic hypoxia. This approach fails to proactively identify ventilation issues, which is a primary concern in this patient population, and thus falls short of best professional practice and regulatory requirements for comprehensive intraoperative monitoring. A third incorrect approach would be to assume that because the surgery is elective and the patient is otherwise healthy, standard monitoring protocols for patients without known risk factors are sufficient. This demonstrates a failure to individualize care based on patient-specific risk factors, a core tenet of safe perianesthesia practice. Ignoring the known OSA diagnosis and its implications for airway management and respiratory control is a significant ethical and regulatory lapse, potentially leading to adverse outcomes. Professional reasoning. Professionals should employ a systematic approach to patient assessment and monitoring. This involves a thorough preanesthesia evaluation to identify risk factors such as OSA. Based on these identified risks, the perianesthesia nurse must then select and implement appropriate monitoring strategies that are tailored to the individual patient's needs and the planned anesthetic. This decision-making process should be guided by established professional standards, regulatory guidelines, such as those from the ASA and ASPAN, and evidence-based practice. Continuous reassessment and adaptation of monitoring based on the patient's response to anesthesia and surgical manipulation are also crucial components of safe perianesthesia care. Question 8. The performance metrics show a concerning trend in perianesthesia patients refusing necessary preoperative interventions, with one case involving a patient with suspected cognitive impairment who verbally refused a routine medication. The perianesthesia nurse is aware the medication is standard protocol for this procedure and is concerned about potential patient safety risks if it is not administered. What is the most ethically and legally sound approach for the perianesthesia nurse to take in this situation, adhering to U.S. regulatory frameworks and professional nursing standards. Option A. Administer the medication as per protocol, documenting the patient's verbal refusal, but proceeding with the intervention based on the physician's order and the perceived need for patient safety. Option B. Document the patient's refusal and cancel or postpone the procedure until the patient fully understands and agrees to the medication, without further investigation into their capacity or seeking alternative consent. Option C. Inform the physician of the patient's refusal and await their direct instruction on how to proceed, without independently assessing the patient's capacity or exploring the rationale behind their decision. Option D. Initiate a formal capacity assessment for the patient. Explore the underlying reasons for their refusal, and if capacity is determined to be lacking, consult with the patient's designated healthcare agent or surrogate decision-maker to obtain consent for the medication. The correct answer is D. Initiate a formal capacity assessment for the patient. Explore the underlying reasons for their refusal, and if capacity is determined to be lacking, consult with the patient's designated healthcare agent or surrogate decision-maker to obtain consent for the medication. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the perceived best interest of the patient as determined by the care team, complicated by the patient's diminished capacity. Navigating this requires a deep understanding of ethical principles like patient autonomy, beneficence, and non-maleficence, as well as legal frameworks governing informed consent and decision-making for incapacitated individuals. The perianesthesia nurse must balance respecting the patient's right to self-determination with the duty to prevent harm. The correct approach represents best professional practice because it prioritizes a structured, ethical, and legally sound process for addressing the patient's refusal of a necessary intervention. This involves a thorough assessment of the patient's capacity, diligent efforts to understand the reasons for refusal, and consultation with appropriate parties, including the patient's designated healthcare agent or surrogate decision-maker if capacity is indeed lacking. This aligns with the ethical principle of respecting autonomy to the greatest extent possible, while also upholding beneficence and non-maleficence by ensuring the patient receives appropriate care, even if that care is ultimately decided by a surrogate. It adheres to legal requirements for informed consent and the process for managing care for patients who cannot make their own decisions, as typically outlined by state laws and professional nursing practice acts in the U.S. An incorrect approach that involves proceeding with the intervention against the patient's expressed wishes, even if the team believes it is for their own good, represents a significant ethical and legal failure. This violates the principle of patient autonomy and could be construed as battery. It bypasses the legally mandated process for obtaining consent or making decisions for incapacitated patients, potentially leading to legal repercussions and a breach of professional trust. Another incorrect approach, which is to simply document the refusal and delay or cancel the procedure without further investigation or consultation, fails to uphold the principle of beneficence. Respecting autonomy is important. If the patient lacks capacity, their refusal may not be a fully informed or rational decision. The nurse has a professional and ethical obligation to ensure the patient receives necessary and appropriate care, which may involve exploring alternatives or seeking a surrogate's consent. This approach could lead to patient harm if the procedure was truly indicated. A third incorrect approach, which is to solely rely on the physician's directive without independent nursing assessment or consideration of the patient's perspective and rights, also presents ethical and legal issues. While physicians are responsible for medical decision-making, nurses have a crucial role in patient advocacy, assessment of capacity, and ensuring informed consent processes are followed. Abdicating this responsibility to the physician alone can lead to overlooking critical patient needs or rights. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the patient's capacity to understand their condition, the proposed treatment, alternatives, and risks/benefits. 2. If capacity is questionable or absent, explore the existence of an advance directive or designated healthcare agent/surrogate. 3. Engage in open and empathetic communication with the patient to understand their concerns and reasons for refusal, even if capacity is limited. 4. Consult with the interdisciplinary team, including the physician, to ensure a shared understanding of the clinical situation and ethical considerations. 5. If a surrogate decision-maker is involved, Ensure they are acting in the patient's best interest or according to the patient's known wishes. 6. Document all assessments, communications, consultations, and decisions thoroughly. 7. Advocate for the patient's rights and well-being throughout the process. Question 9. Cost-benefit analysis shows that implementing a less frequent vital sign monitoring schedule for stable ambulatory surgical patients post-anesthesia could reduce nursing staff time. Which of the following approaches best upholds the perianesthesia nurse's responsibility for patient safety and adherence to regulatory standards in the United States? Option A. Relying exclusively on continuous pulse oximetry and automated blood pressure monitoring alarms to alert staff to significant vital sign changes, minimizing direct nursing observation. Option B. Delegating all vital sign monitoring to a newly hired, unlicensed assistive personnel who has completed basic vital sign training, with the registered nurse performing only a brief visual check every 30 minutes. Option C. Reducing the frequency of vital sign checks to once per hour for all patients deemed stable by the nurse, without a physician's order, to reallocate nursing resources. Option D. Maintaining the current, evidence-based vital sign monitoring schedule as dictated by institutional policy and perianesthesia nursing standards, regardless of perceived cost savings, to ensure early detection of potential complications. The correct answer is D. Maintaining the current, evidence-based vital sign monitoring schedule as dictated by institutional policy and perianesthesia nursing standards, regardless of perceived cost savings, to ensure early detection of potential complications. Explanation. This scenario presents a professional challenge due to the inherent variability in patient responses to anesthesia and the critical need for timely and accurate vital sign monitoring in the ambulatory perianesthesia setting. Balancing the cost of resources with the imperative of patient safety requires careful consideration of established perianesthesia nursing standards and regulatory guidelines. The correct approach represents best professional practice because it aligns with the core principles of perianesthesia nursing as defined by professional organizations and regulatory bodies governing patient care in the United States. Specifically, it emphasizes continuous, vigilant assessment of vital signs, recognizing that deviations can be early indicators of complications such as hypoventilation, hypothermia, or cardiovascular instability. Adherence to established protocols for monitoring frequency and intervention based on vital sign parameters ensures that patient needs are met promptly, minimizing the risk of adverse events and promoting a safe recovery. This proactive stance is ethically mandated by the principle of beneficence and legally supported by standards of care. An incorrect approach that prioritizes cost savings by reducing the frequency of vital sign monitoring without a clear clinical justification or physician order would represent a significant regulatory and ethical failure. This would violate the standard of care, potentially leading to delayed recognition of patient deterioration, which could result in harm. Such an action would contraindicate the ethical duty of non-maleficence and could expose the healthcare facility and the nurse to legal liability for negligence. Another incorrect approach, such as relying solely on automated alarms without direct nursing assessment, fails to acknowledge the limitations of technology and the nuanced interpretation required in perianesthesia care. Alarms can be triggered by artifact or may not detect subtle but significant changes. This approach neglects the professional responsibility to actively observe and interpret patient data in the context of their overall clinical picture, a failure in professional judgment, and a potential breach of the standard of care. A third incorrect approach, involving the delegation of vital sign monitoring to unlicensed assistive personnel without adequate supervision or clear protocols for escalation of concerns, also presents regulatory and ethical issues. While delegation is a part of efficient care delivery, the ultimate responsibility for patient assessment and the interpretation of vital signs remains with the licensed nurse. Failure to ensure proper oversight and communication channels can lead to missed critical findings and compromised patient safety, violating principles of accountability and responsible delegation. The professional decision-making process for similar situations should involve a systematic approach. First, understanding the patient's baseline status and the expected physiological responses to the specific anesthetic and surgical procedure. Second, consulting and adhering to institutional policies and evidence-based guidelines for perianesthesia vital sign monitoring. Third, critically evaluating the patient's condition and the reliability of monitoring data, using clinical judgment to determine the appropriate frequency and type of assessment. Finally, communicating any concerns or deviations from the norm promptly to the anesthesia provider or physician. This process ensures that patient safety remains paramount while optimizing resource utilization within the established regulatory and ethical framework. Question 10. Assessment of a patient scheduled for moderate sedation reveals they initially consented but are now expressing significant anxiety about the specific sedative agent being used, stating, "I'm not sure I want that drug, it sounds scary." The perianesthesia nurse has confirmed the physician's order for moderate sedation and the patient's initial consent. What is the most appropriate immediate nursing action? Option A. Reassess the patient's understanding of the sedative agent, its effects and potential risks, and reconfirm their informed consent for moderate sedation. Option B. Document the patient's anxiety and proceed with the physician's order for moderate sedation, as initial consent was obtained. Option C. Proceed with administering the moderate sedation as ordered, reassuring the patient that it is safe and effective. Option D. Delay the procedure to address the patient's general anxiety, then proceed with administering the moderate sedation as ordered. The correct answer is A. Reassess the patient's understanding of the sedative agent, its effects and potential risks, and reconfirm their informed consent for moderate sedation. Explanation. This scenario presents a professional challenge due to the inherent conflict between patient autonomy, the nurse's duty of care, and the potential for coercion or undue influence when administering moderate sedation. The nurse must navigate the patient's expressed desire for sedation against the backdrop of potential underlying anxieties or misunderstandings that might impair their true informed consent. Careful judgment is required to ensure the patient's decision is truly voluntary and based on adequate understanding of the procedure, risks, benefits, and alternatives, especially when the patient is already in a vulnerable state prior to a procedure. The correct approach represents best professional practice because it prioritizes a thorough and ongoing assessment of the patient's capacity and understanding of informed consent for moderate sedation. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy. Specifically, it adheres to the standards of care for perianesthesia nursing, which mandate that nurses actively participate in the informed consent process, ensuring patients comprehend the implications of sedation. This includes verifying that the patient has received and understood information about the sedation agent, its effects, potential side effects, and the recovery process, and that their consent is freely given without coercion. An incorrect approach that proceeds with sedation without reevaluating the patient's understanding after they express anxiety about the sedation agent fails to uphold the principle of autonomy. The patient's anxiety indicates a potential deficit in their comprehension or a change in their willingness, necessitating a pause and further education, not a dismissal of their concerns. This could lead to a situation where consent is not truly informed or voluntary, violating ethical and regulatory expectations for patient rights. Another incorrect approach that involves proceeding with sedation based solely on the physician's order, disregarding the patient's expressed anxiety, represents a failure in the nurse's professional responsibility to advocate for the patient and ensure their safety and understanding. Physician orders are crucial. They do not absolve the nurse of their independent assessment and ethical obligations. This approach risks violating the patient's right to informed consent and could be construed as negligence. A further incorrect approach that involves delaying the procedure to address the patient's anxiety without reassessing their understanding of the sedation itself, and then proceeding with sedation without confirming comprehension, is also problematic. While addressing anxiety is important, the core issue is the patient's informed consent for sedation. If the anxiety is related to the sedation, then the focus must be on clarifying the sedation process and its implications. Simply delaying the procedure without re-engaging in the informed consent discussion for sedation does not resolve the potential consent issue. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize the patient's expressed concern as a signal for potential issues with informed consent or comfort. 2. Pause the planned intervention sedation. 3. Reassess the patient's understanding of the procedure and the sedation, including the specific agent, its effects, and potential risks and benefits. 4. Provide clear, concise, and understandable information to address the patient's anxieties and ensure comprehension. 5. Reconfirm the patient's voluntary and informed consent. 6. Document the assessment, interventions, and reconfirmation of consent. 7. If doubts persist about the patient's capacity or true consent, consult with the physician and potentially an ethics committee. Question 11. Comparative studies suggest that postoperative nausea and vomiting (PONV) can be a significant factor impacting patient satisfaction and recovery time in ambulatory surgical settings. A patient recovering from a laparoscopic cholecystectomy begins to experience moderate nausea and vomits twice within an hour postoperatively. The patient's vital signs are stable, but they appear distressed and report feeling very sick. The perianesthesia nurse is assessing the patient for discharge readiness. Which of the following actions represents the most appropriate next step in the patient's postoperative assessment and management? Option A. Administer a prescribed antiemetic and reassess the patient's nausea and comfort level in 30 minutes before proceeding with discharge criteria evaluation. Option B. Document the vomiting episode and proceed with the standard discharge checklist. As PONV is a common side effect, Option C. Immediately notify the surgeon and anesthesiologist of the vomiting episode and await their direct orders before any further intervention. Option D. Offer the patient clear liquids and encourage deep breathing exercises to help alleviate the nausea. The correct answer is A. Administer a prescribed antiemetic and reassess the patient's nausea and comfort level in 30 minutes before proceeding with discharge criteria evaluation. Explanation. Scenario analysis. This scenario presents a common challenge in ambulatory perianesthesia nursing, managing a patient experiencing unexpected postoperative nausea and vomiting (PONV) that deviates from the typical recovery trajectory. The challenge lies in accurately assessing the severity of the PONV, differentiating it from other potential complications, and implementing an appropriate, evidence-based intervention while ensuring patient safety and adherence to perianesthesia standards of care. The nurse must balance the patient's immediate comfort with the need to identify and address any underlying issues that might compromise recovery or indicate a more serious problem. Correct approach analysis. The correct approach involves a systematic and comprehensive postoperative assessment. This includes a thorough evaluation of the patient's vital signs, level of consciousness, pain, and the characteristics of the nausea and vomiting, frequency, volume, presence of blood. Crucially, it requires comparing the current assessment findings with the patient's baseline and expected recovery parameters established during the preanesthesia assessment and intraoperative period. This aligns with the CAPA standards of practice, which emphasize ongoing, individualized patient assessment and the ability to recognize and respond to deviations from the norm. The nurse's responsibility extends to initiating appropriate interventions based on the assessment, which may include pharmacological management of PONV, fluid resuscitation if indicated, and further diagnostic evaluation if the symptoms are severe or persistent. This approach prioritizes patient safety, promotes optimal recovery, and adheres to the ethical obligation of providing competent and compassionate care. Incorrect approach is analysis. One incorrect approach is to dismiss the PONV as a typical, expected side effect and simply offer routine antiemetics without a thorough reassessment. This fails to acknowledge that PONV can sometimes be a symptom of a more serious complication, such as hypovolemia, electrolyte imbalance, or even a neurological event. Ethically, this constitutes a failure to provide individualized care and a potential breach of the duty of care. Regulatory frameworks for perianesthesia nursing mandate a comprehensive assessment to identify and manage potential complications, not just routine symptoms. Another incorrect approach is to immediately escalate care to a physician without performing an adequate initial assessment and attempting appropriate nursing interventions. While collaboration with the physician is essential, the perianesthesia nurse is trained and expected to perform initial assessments and implement interventions within their scope of practice. Delaying this initial assessment and intervention can prolong the patient's discomfort and potentially delay the diagnosis of a more serious issue. This approach demonstrates a lack of professional autonomy and a failure to utilize the full scope of perianesthesia nursing practice as outlined by professional organizations and regulatory bodies. A third incorrect approach is to focus solely on symptom relief without considering the underlying cause or the patient's overall recovery status. For example, administering multiple antiemetics without assessing for dehydration or electrolyte disturbances could mask a more significant problem. This approach is not aligned with the holistic care expected of a perianesthesia nurse, who must consider the patient's entire physiological and psychological state postoperatively. Regulatory guidelines emphasize a comprehensive approach to patient care, not just symptomatic treatment. Professional reasoning. Professionals facing this situation should employ a structured decision-making process. First, perform a comprehensive head-to-toe assessment, comparing findings to the patient's baseline and expected recovery. Second, identify potential causes for the deviation from the expected recovery, considering both common and less common complications. Third, consult established perianesthesia protocols and evidence-based guidelines for managing PONV and other potential postoperative issues. Fourth, initiate appropriate nursing interventions within the scope of practice, such as administering prescribed antiemetics, ensuring adequate hydration, and managing pain. Fifth, document all assessments, interventions, and patient responses meticulously. Finally, collaborate with the anesthesia provider or physician as indicated by the patient's condition and the established care plan, escalating care when necessary. This systematic approach ensures patient safety, promotes optimal outcomes, and upholds professional standards. Question 12. System analysis indicates a patient recovering from ambulatory surgery has been prescribed a standard dose of a short-acting opioid analgesic for post-operative pain. The patient's electronic health record reveals moderate renal insufficiency. What is the most appropriate perianesthesia nursing action to ensure patient safety and effective pain management? Option A. Administer the prescribed opioid dose and closely monitor for signs of respiratory depression and sedation. Option B. Delay administration of the opioid until the patient reports severe pain and then administer the full prescribed dose. Option C. Administer the prescribed opioid dose as ordered and document the patient's pain level. Option D. Administer a reduced dose of the opioid analgesic and implement enhanced monitoring for pain relief and adverse effects. Correct answer is A. Administer the prescribed opioid dose and closely monitor for signs of respiratory depression and sedation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the perianesthesia nurse to integrate complex pharmacokinetic and pharmacodynamic principles into a real-time clinical decision regarding patient safety and efficacy of pain management post-ambulatory surgery. The challenge lies in anticipating and mitigating potential adverse drug events arising from altered drug metabolism and response in a patient with a known comorbidity that significantly impacts drug disposition. The nurse must move beyond routine medication administration to a proactive, risk assessment-driven approach, balancing the need for effective pain control with the imperative to avoid patient harm. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the core principles of perianesthesia nursing as outlined by the American Society of Perianesthesia Nurses, ASPAN Standards of Perianesthesia Nursing Practice. Specifically, it aligns with the standard of assessment and diagnosis, requiring the nurse to gather and analyze patient data, including comorbidities and their potential impact on drug therapy. Furthermore, it embodies the planning and implementation standards by requiring the nurse to anticipate potential drug interactions and adverse effects based on pharmacokinetic and pharmacodynamic knowledge, and to develop a plan for vigilant monitoring and timely intervention. This proactive risk assessment is crucial for patient safety, preventing adverse events, and ensuring optimal pain management within the ambulatory setting, thereby upholding the ethical obligation to provide competent and individualized care. Incorrect approach is analysis. An incorrect approach would be to administer the prescribed opioid analgesic without considering the patient's renal insufficiency and its implications for drug clearance. This failure to assess and anticipate potential drug accumulation and prolonged effects would violate the ASPAN standards related to assessment and planning, and could lead to opioid-induced respiratory depression or other serious adverse events, constituting a breach of the ethical duty to avoid harm. Another incorrect approach would be to solely rely on the surgeon's prescription without independent clinical judgment or further investigation into the patient's specific physiological status. While respecting the medical order is essential, perianesthesia nurses are expected to exercise critical thinking and apply their specialized knowledge to ensure patient safety, especially when known risk factors are present. This passive acceptance of the order, without considering the pharmacokinetic implications of renal impairment, would be a failure of professional responsibility. A third incorrect approach would be to delay pain management until the patient exhibits overt signs of inadequate pain control, without proactively assessing the risk of adverse effects. This reactive rather than proactive stance fails to leverage pharmacokinetic and pharmacodynamic knowledge to prevent complications. It also neglects the ESPAN standard of evaluation, which requires ongoing assessment of patient outcomes and the effectiveness of interventions, including pain management. Professional reasoning. Professionals should employ a systematic risk assessment framework. This involves 1. Identifying the patient's baseline physiological status and any comorbidities, e.g., renal insufficiency. 2. Understanding the pharmacokinetic profile of the prescribed medication, particularly its route of elimination, e.g., renal excretion for many opioids. 3. Predicting the pharmacodynamic effects and potential for exaggerated or prolonged responses due to impaired drug clearance. 4. Developing a proactive plan for medication administration, including dose adjustments if indicated, and implementing enhanced monitoring for anticipated adverse effects. 5. Establishing clear criteria for intervention and communication with the medical team. This process ensures that care is individualized, evidence-based, and prioritizes patient safety in accordance with professional standards and ethical obligations. Question 13. To address the challenge of a critical staffing shortage impacting the ability to provide continuous, dedicated monitoring for a patient undergoing a procedure requiring deep sedation, which of the following actions best upholds the Certified Ambulatory Perianesthesia Nurse, CAPA, standards and U.S. regulatory frameworks for patient safety? Option A. The registered nurse caring for the sedated patient ensures that a qualified and available registered nurse is assigned solely to monitor the sedated patient's vital signs and level of consciousness throughout the procedure and recovery period. Option B. The registered nurse caring for the sedated patient continues to monitor the patient while also performing other direct patient care tasks for other patients in the recovery area. Option C. The registered nurse caring for the sedated patient delegates the responsibility of continuous monitoring to another registered nurse who is simultaneously managing 2 other stable post-operative patients. Option D. The registered nurse caring for the sedated patient requests that a licensed practical nurse with general patient care experience, but no specific sedation monitoring training, perform intermittent checks on the sedated patient. The correct answer is C. The registered nurse caring for the sedated patient delegates the responsibility of continuous monitoring to another registered nurse who is simultaneously managing 2 other stable post-operative patients. Explanation. The scenario presents a common implementation challenge in ambulatory perianesthesia settings, ensuring consistent and safe deep sedation practices when staffing levels are unexpectedly reduced. This is professionally challenging because the nurse is responsible for patient safety and adherence to established protocols, even under pressure. The core of the challenge lies in balancing the need for adequate patient monitoring and care with the reality of limited resources. Careful judgment is required to avoid compromising patient outcomes or violating regulatory standards. The correct approach represents best professional practice because it prioritizes patient safety by ensuring that the patient receiving deep sedation is continuously and appropriately monitored by a qualified individual. This aligns with the fundamental ethical and regulatory principles of perianesthesia care, which mandate vigilant observation during and after sedation to detect and manage potential adverse events promptly. Specifically, U.S. regulatory frameworks and CAPA guidelines emphasize the need for dedicated, qualified personnel to monitor patients receiving deep sedation, ensuring immediate intervention capabilities. This approach upholds the standard of care and minimizes risks associated with inadequate monitoring. An incorrect approach that involves the registered nurse caring for the sedated patient also performing other direct patient care duties is professionally unacceptable. This violates regulatory requirements for continuous monitoring during deep sedation. The nurse's attention would be divided, increasing the risk of delayed recognition of respiratory depression, airway obstruction, or hemodynamic instability. This failure to provide dedicated monitoring constitutes a breach of the standard of care and a violation of patient safety regulations. Another incorrect approach Relying solely on intermittent checks by a less experienced staff member without specific sedation monitoring training is also professionally unacceptable. Deep sedation requires specialized knowledge and skills for monitoring and managing potential complications. Intermittent checks are insufficient to detect subtle but critical changes in a patient's status, and the lack of specialized training means the individual may not be equipped to recognize or respond to emergent situations effectively. This exposes the patient to significant risk and contravenes established perianesthesia care standards. The professional reasoning process for similar situations should involve a systematic assessment of the situation, identification of risks, and adherence to established protocols. When faced with staffing challenges, the priority must always be patient safety. This involves understanding the specific requirements for the level of sedation being administered, identifying the minimum staffing and monitoring requirements mandated by regulatory bodies and institutional policy, and communicating any perceived risks or deviations from protocol to the appropriate supervisory personnel. If the required level of safe care cannot be provided due to staffing shortages, the procedure should be postponed or reassigned until adequate resources are available. Question 14. Market research demonstrates a growing trend towards the increased use of regional anesthesia techniques in ambulatory surgical centers for a variety of procedures. A perianesthesia nurse is reviewing the preoperative assessment for a patient scheduled for a minor orthopedic procedure under a proposed femoral nerve block. The surgeon has indicated a preference for this specific technique. What is the most appropriate course of action for the perianesthesia nurse in this situation? Option A. Inform the surgeon that regional anesthesia is not the preferred method for ambulatory surgery and suggest a general anesthetic instead, without further patient assessment. Option B. Independently assess the patient's medical history, current medications, and the specific surgical procedure to determine the suitability of the proposed femoral nerve block, ensuring the patient understands the risks and benefits, and consulting with the surgeon if any concerns arise. Option C. Proceed with the femoral nerve block as requested by the surgeon, assuming it is appropriate given the surgeon's expertise and the general safety of regional anesthesia in the ambulatory setting. Option D. Administer the femoral nerve block without further patient discussion, as the surgeon has already deemed it the preferred method for this procedure. Correct answer is B. Independently assess the patient's medical history, current medications, and the specific surgical procedure to determine the suitability of the proposed femoral nerve block, ensuring the patient understands the risks and benefits, and consulting with the surgeon if any concerns arise. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the perianesthesia nurse to balance patient safety, physician preference, and the evolving understanding of anesthetic techniques within the ambulatory setting. The nurse must critically evaluate the appropriateness of a specific anesthetic technique for a particular patient profile and surgical procedure, considering potential risks and benefits that may not be immediately apparent to the performing physician. This necessitates a strong understanding of perianesthesia nursing standards and the ability to advocate for the patient's well-being. Correct approach analysis. The correct approach involves the perianesthesia nurse proactively reviewing the patient's medical history, current medications, and the planned surgical procedure to identify any contraindications or risk factors associated with the proposed regional anesthesia technique. This includes assessing the patient's understanding of the procedure and potential complications, and ensuring that the chosen technique aligns with established perianesthesia nursing standards of care and best practices as outlined by professional organizations relevant to the CAPA certification. This aligns with the ethical obligation to provide safe and competent care, prioritizing patient well-being and informed consent. Incorrect approach is analysis. One incorrect approach involves the perianesthesia nurse deferring entirely to the surgeon's preference without independent assessment. This fails to uphold the nurse's professional responsibility to critically evaluate the appropriateness of the anesthetic plan for the individual patient, potentially overlooking patient-specific risks or contraindications that the surgeon may not have fully considered in the context of perianesthesia care. This could lead to adverse patient outcomes and violates the principle of patient advocacy. Another incorrect approach is to proceed with the regional anesthesia without confirming the patient's understanding of the procedure and potential risks. This violates the ethical and regulatory requirement for informed consent, which is a cornerstone of patient care. perianesthesia nurse has a crucial role in ensuring the patient is adequately informed and has the opportunity to ask questions before agreeing to the anesthetic. A third incorrect approach is to assume that because regional anesthesia is generally considered safe for ambulatory surgery, it is appropriate for all patients undergoing such procedures. This overlooks the critical need for individualized patient assessment and the potential for specific patient factors, e.g., bleeding disorders, neurological conditions, patient anxiety, to make a particular regional technique less suitable or even contraindicated. This demonstrates a failure to apply critical thinking and adhere to the principle of individualized care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, including a review of the medical record and direct patient interview. This should be followed by an evaluation of the planned procedure and the proposed anesthetic technique, considering established guidelines and best practices. The nurse must then communicate any concerns or recommendations to the physician and ensure the patient is fully informed and has provided consent. This iterative process of assessment, evaluation, communication, and patient engagement is essential for safe and effective perianesthesia nursing practice. Question 15. The control framework reveals that a perianesthesia nurse is preparing to discharge a patient following a minor outpatient surgical procedure. The patient reports feeling generally well, with minimal pain and no immediate concerns. However, the nurse is aware that certain complications, though rare, can manifest several hours post-operatively. Which of the following monitoring and discharge strategies best aligns with the CAPA certification's emphasis on comprehensive patient safety and risk mitigation in the ambulatory setting? Option A. Provide the patient with a standard discharge checklist and verbally confirm they understand the general instructions for rest and hydration. Option B. Rely on the patient's self-report of feeling well as the primary indicator for discharge readiness, assuming no immediate post-operative abnormalities were noted. Option C. Conduct a thorough post-anesthesia assessment, including a review of potential procedure-specific complications, provide individualized verbal and written instructions on warning signs, and confirm patient/caregiver comprehension before discharge. Option D. Advise the patient to contact their primary care physician if any issues arise within the next 24 hours, without specific guidance on what to monitor for. The correct answer is A. Provide the patient with a standard discharge checklist and verbally confirm they understand the general instructions for rest and hydration. Explanation. This scenario is professionally challenging because the perianesthesia nurse must balance immediate patient needs with the potential for delayed, serious complications, all within the dynamic environment of ambulatory surgery. The nurse's responsibility extends beyond the immediate post-operative period, requiring vigilance for signs of evolving issues that may not be apparent at discharge. Accurate and timely identification of potential complications is paramount to patient safety and adherence to established perianesthesia standards of care. The correct approach represents best professional practice because it aligns with the core principles of perianesthesia nursing as outlined by professional organizations and regulatory bodies governing nursing practice in the United States. Specifically, it emphasizes a comprehensive, individualized assessment that considers the patient's specific procedure, anesthetic, and pre-existing conditions. This proactive monitoring, including patient and caregiver education on warning signs and follow-up instructions, directly addresses the CAPA certification's focus on ensuring safe and effective perianesthesia care. This approach minimizes the risk of adverse outcomes by facilitating early intervention and preventing escalation of complications. It is ethically mandated by the nursing profession's commitment to patient well-being and beneficence. An incorrect approach that relies solely on the absence of immediate post-operative symptoms fails to acknowledge the potential for delayed complications, such as infection, hematoma, or respiratory compromise, which can manifest hours or even days after discharge. This oversight constitutes a failure to adhere to the standard of care for perianesthesia nursing, potentially violating state nurse practice acts that mandate competent and safe patient care. Another incorrect approach that delegates the responsibility of monitoring for specific, known post-operative risks to the patient without adequate, clear, and documented education is also professionally unacceptable. This can lead to a breakdown in communication and a failure to identify critical warning signs, thereby breaching the nurse's duty of care and potentially violating ethical principles of non-maleficence. A third incorrect approach that prioritizes discharge efficiency over thorough post-anesthesia assessment and education, particularly regarding potential complications, neglects the fundamental responsibility of ensuring patient readiness for home recovery and the ability to manage post-operative care. This can lead to readmissions and adverse events, reflecting a failure to uphold professional standards and a disregard for patient safety. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's individual risk factors and the specific procedure performed. This should be followed by a comprehensive post-anesthesia assessment, including vital signs, pain assessment, and evaluation for common and procedure-specific complications. Crucially, this assessment must be coupled with clear, concise, and documented patient and caregiver education regarding expected recovery, potential warning signs of complications, and when and how to seek further medical attention. Ongoing professional development and adherence to current perianesthesia guidelines are essential to maintaining this competency. Question 16. The monitoring system demonstrates a sustained decrease in oxygen saturation to 88% and a respiratory rate of 10 breaths per minute in a patient who received rocuronium 45 minutes ago for intubation. The patient exhibits noticeable muscle weakness and difficulty lifting their head. What is the most appropriate immediate nursing intervention? Option A. Increase the oxygen flow rate to 10 liters per minute via nasal cannula. Option B. Administer midazolam to promote rest. Option C. Administer a respiratory stimulant such as doxapram. Option D. Administer neostigmine and glycopyrrolate. The correct answer is D. Administer neostigmine and glycopyrrolate. Explanation. This scenario is professionally challenging due to the potential for a serious adverse drug event in a vulnerable patient population undergoing perianesthesia care. The nurse must integrate real-time physiological data with pharmacological knowledge to make an immediate, safe, and effective clinical decision. CAPA nurse's responsibility extends beyond simple medication administration to include vigilant monitoring, assessment of patient response, and timely intervention based on established perianesthesia nursing standards and pharmacology principles. The correct approach represents best professional practice because it prioritizes patient safety by directly addressing the observed physiological signs of a potential adverse reaction to a neuromuscular blocking agent, promptly administering a reversal agent, as indicated by the patient's persistent muscle weakness and the known pharmacology of the drug administered, aligns with the CAPA nurse's scope of practice and the ethical imperative to prevent harm. This action is supported by perianesthesia nursing guidelines that emphasize proactive management of postoperative respiratory complications and the appropriate use of reversal agents based on clinical assessment and monitoring data. Administering a respiratory stimulant without a clear indication or further assessment is an incorrect approach. This fails to address the root cause of the patient's respiratory compromise, which is likely residual neuromuscular blockade. Relying solely on a respiratory stimulant could mask the underlying problem, delay appropriate treatment, and potentially lead to a more severe respiratory event. This deviates from the principle of treating the underlying pathology and represents a failure to adhere to evidence-based perianesthesia care standards. Increasing the oxygen flow rate without addressing the neuromuscular blockade is also an incorrect approach. While oxygen is a supportive measure, it does not resolve the underlying issue of inadequate muscle function for effective ventilation. This approach is insufficient and could create a false sense of security while the patient's condition deteriorates. It fails to meet the standard of care for managing residual neuromuscular blockade and could be considered a breach of professional duty to intervene effectively. Administering a sedative to promote rest is a critically incorrect approach. Sedation in a patient experiencing respiratory distress due to neuromuscular blockade would further depress respiratory drive, exacerbating the problem and significantly increasing the risk of respiratory arrest. This action directly contradicts the fundamental principles of perianesthesia patient management, which demand vigilant respiratory assessment and support, and represents a severe ethical and professional failure. The professional decision-making process for similar situations involves a systematic approach. 1. Assess the patient's current status, integrating all available monitoring data. 2. Identify potential causes for the observed signs and symptoms, considering recent pharmacological interventions. 3. Consult perianesthesia nursing protocols and pharmacological references for appropriate management strategies. 4. Implement the most appropriate intervention based on the assessment and protocols, prioritizing patient safety and efficacy. 5. Continuously reassess the patient's response to interventions and adjust the plan of care as needed. Question 17. Consider a scenario where a patient undergoing a lower extremity orthopedic procedure receives spinal anesthesia. Post-induction, the patient's blood pressure drops from 130/80 mmHg to 90/50 mmHg, and their heart rate decreases from 70 bpm to 50 bpm. The patient reports feeling nauseous and clammy. What is the most appropriate immediate nursing intervention? Option A. Administer intravenous fluids and a vasopressor and notify the anesthesia provider. Option B. Elevate the patient's legs and administer an antiemetic. Option C. Document the findings and wait for the anesthesia provider to assess the patient. Option D. Reassure the patient and monitor their vital signs closely for further changes. Correct answer is A. Administer intravenous fluids and a vasopressor and notify the anesthesia provider. Explanation. This scenario presents a common yet critical challenge in perianesthesia care, managing a patient experiencing a potential complication of spinal anesthesia. The professional challenge lies in the rapid assessment and appropriate intervention to mitigate harm and ensure patient safety, requiring a nuanced understanding of spinal anesthesia side effects and their management within the perianesthesia nursing scope of practice. Careful judgment is required to differentiate between expected physiological responses and emergent complications. The correct approach represents best professional practice because it prioritizes immediate, evidence-based interventions for the most likely and dangerous complication of spinal anesthesia, hypotension and bradycardia, which can rapidly lead to hypoperfusion and organ damage. This aligns with established perianesthesia nursing standards of care and the CAPA certification's emphasis on patient safety and management of anesthetic-related complications. Prompt recognition and treatment of these signs are paramount to preventing adverse outcomes. An incorrect approach that delays or dismisses these vital signs as insignificant would represent a failure to adhere to the standard of care for patients receiving spinal anesthesia. Specifically, failing to recognize and treat hypotension and bradycardia promptly constitutes a breach of professional responsibility and potentially violates guidelines for patient monitoring and emergency management in perianesthesia settings. Another incorrect approach that involves administering medications without a clear diagnosis or in a manner inconsistent with established protocols for managing spinal-induced hypotension and bradycardia would also be professionally unacceptable, potentially leading to iatrogenic harm. The professional decision-making process for similar situations should involve a systematic approach. 1. Rapidly assess the patient's vital signs and overall clinical presentation. 2. Correlate findings with the anesthetic administered and potential complications. 3. Prioritize interventions based on the severity and likelihood of the complication. 4. Initiate immediate, evidence-based management. 5. Continuously reassess the patient's response to interventions. 6. Communicate effectively with the anesthesia provider and other members of the healthcare team. 7. Document all assessments and interventions accurately. Question 18. The investigation demonstrates that a newly implemented perianesthesia patient safety protocol has been in place for 6 months. To assess its effectiveness and identify areas for improvement, which of the following approaches would be most aligned with certified ambulatory perianesthesia nurse, CAPA, standards for patient safety and quality improvement? Option A. Rely on informal discussions with perianesthesia staff to gauge their general perception of the protocol's impact and assume its effectiveness based on the absence of major reported incidents. Option B. Conduct a comprehensive review of patient incident reports related to the protocol's focus area, analyze patient satisfaction survey data, and solicit feedback from the interdisciplinary perianesthesia team regarding observed changes in patient care and safety. Option C. Focus the assessment primarily on the cost savings realized since the protocol's implementation, using this as the primary metric for its success. Option D. Implement the protocol and consider the quality improvement cycle complete without any further data collection or analysis, assuming the protocol's design inherently ensures optimal patient safety. The correct answer is B. Conduct a comprehensive review of patient incident reports related to the protocol's focus area, analyze patient satisfaction survey data, and solicit feedback from the interdisciplinary perianesthesia team regarding observed changes in patient care and safety. Explanation: this scenario presents a professional challenge because it requires a perianesthesia nurse to critically evaluate the effectiveness of a new patient safety protocol in a real-world setting, balancing the need for evidence-based practice with the potential for unintended consequences. Careful judgment is required to determine the most appropriate method for assessing the protocol's impact on patient outcomes and to identify areas for improvement. The correct approach represents best professional practice because it directly addresses the core principles of patient safety and quality improvement, as mandated by perianesthesia nursing standards and regulatory bodies. By collecting and analyzing objective data on adverse events and patient satisfaction, the nurse can provide concrete evidence of the protocol's efficacy or identify specific areas where it falls short. This data-driven approach aligns with the continuous quality improvement (CQI) framework, which emphasizes systematic monitoring and evaluation to enhance patient care. Furthermore, involving the interdisciplinary team in the analysis and subsequent revisions ensures a comprehensive and collaborative approach to patient safety, fostering a culture of shared responsibility and accountability. This aligns with ethical obligations to provide competent and safe care and regulatory requirements for quality assurance. An incorrect approach that relies solely on anecdotal evidence or personal opinions from staff would be professionally unacceptable. This fails to meet the standards for evidence-based practice and quality improvement, as it lacks objective data to support conclusions. Such an approach could lead to the premature adoption or rejection of a protocol without a clear understanding of its true impact, potentially compromising patient safety. Ethically, it violates the principle of beneficence by not ensuring the most effective interventions are implemented. Regulatory failure would occur as it bypasses established quality assurance processes that demand data-driven decision-making. Another incorrect approach that focuses only on the financial implications of the protocol, without a thorough assessment of its impact on patient safety and quality, is also professionally unacceptable. While cost-effectiveness is a consideration in healthcare, it should never supersede patient well-being. Prioritizing financial gains over patient outcomes is an ethical breach and a failure to uphold the primary responsibility of a healthcare professional. This approach would also likely fail to meet regulatory requirements for quality improvement initiatives, which are centered on patient outcomes. A third incorrect approach that involves implementing the protocol without any post-implementation evaluation would be professionally unacceptable. This demonstrates a lack of commitment to continuous quality improvement and a failure to learn from practice. It suggests a passive approach to patient safety, where the assumption is that implementation alone guarantees positive outcomes. This neglects the dynamic nature of healthcare and the need for ongoing assessment and adaptation to ensure sustained safety and quality. Regulatory bodies expect proactive monitoring and evaluation of all implemented interventions. The professional decision-making process for similar situations should involve a systematic approach. 1. Clearly define the quality improvement goal or patient safety concern. 2. Identify relevant evidence-based practices and potential interventions. 3. Develop a plan for implementation, including data collection methods. 4. Implement the intervention and collect objective data on patient outcomes, safety events, and patient/staff feedback. 5. Analyze the collected data to assess the effectiveness of the intervention. 6. Collaborate with the interdisciplinary team to interpret findings and make informed decisions about modifications or continuation. 7. Document all steps and outcomes for accountability and future reference. 8. Adhere to all relevant professional standards, ethical principles, and regulatory guidelines throughout the process. Question 19. Upon reviewing the pre-anesthetic assessment for a 68-year-old male scheduled for an outpatient arthroscopic knee surgery, you note that he is currently taking a beta blocker for hypertension and has a history of asthma. The anesthesia provider has tentatively planned to use propofol for induction and maintenance of anesthesia, with sevoflurane as the primary inhalational agent. What is the most critical consideration regarding the planned anesthetic agents in relation to this patient's medical history? Option A. The patient's history of asthma is a contraindication to propofol due to potential anaphylactic reactions. Option B. The patient's history of asthma requires careful monitoring for bronchospasm, as sevoflurane can be a respiratory irritant. Option C. The patient's beta blocker use is a significant contraindication to the use of sevoflurane due to the risk of severe bradycardia and hypotension. Option D. The patient's beta blocker use may necessitate a modification in the dosage of propofol due to potential additive hypotensive effects. The correct answer is D. The patient's beta blocker use may necessitate a modification in the dosage of propofol due to potential additive hypotensive effects. Explanation: this scenario is professionally challenging because it requires the perianesthesia nurse to synthesize patient history, current medication, and potential drug interactions to ensure patient safety during the perioperative period. The perianesthesia nurse must possess a deep understanding of common anesthetic agents, their side effects, and contraindications, particularly in the context of ambulatory surgery, where patient discharge criteria are stringent. Careful judgment is required to identify subtle signs of potential adverse reactions and to intervene proactively. The correct approach represents best professional practice because it prioritizes patient safety by meticulously reviewing the patient's medication profile and identifying a significant contraindication to the planned anesthetic agent. This aligns with the ethical and regulatory mandates of perianesthesia nursing practice, which emphasize thorough pre-anesthetic assessment and the prevention of harm. Specifically, the perianesthesia nurse is acting as a patient advocate, ensuring that the chosen anesthetic is appropriate and safe given the patient's medical history, thereby adhering to standards of care that require individualized patient assessment and management. This proactive identification of a contraindication prevents a potentially serious adverse event, upholding the nurse's responsibility to provide competent and safe care. An incorrect approach that involves proceeding with the planned anesthetic without addressing the identified contraindication represents a failure to adhere to the fundamental principles of patient safety and professional nursing standards. This could lead to severe adverse outcomes for the patient, such as a hypersensitivity reaction or exacerbation of a pre-existing condition, directly violating the nurse's duty of care. It also demonstrates a lack of critical thinking and a failure to apply knowledge of pharmacology and patient assessment, which are core competencies for perianesthesia nurses. Furthermore, such an action could be considered a breach of professional conduct and potentially lead to disciplinary action by regulatory bodies. Another incorrect approach, such as documenting the concern but not actively communicating it to the anesthesia provider or delaying the discussion, also fails to meet professional standards. While documentation is important, it is insufficient if it does not lead to timely and effective intervention. The perianesthesia nurse has a responsibility to ensure that critical patient safety information is communicated promptly to the entire perioperative team to facilitate informed decision-making and prevent harm. This delay could result in the administration of a contraindicated medication, leading to adverse events. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the patient's medical history, including current medications, allergies, and past anesthetic experiences. 2. Identify any potential drug interactions or contraindications based on the planned anesthetic agents and the patient's profile. 3. Consult relevant pharmacological resources and institutional protocols. 4. Communicate any identified concerns or contraindications clearly and promptly to the anesthesia provider. 5. Collaborate with the anesthesia provider to determine an alternative, safe anesthetic plan if necessary. 6. Document all assessments, communications, and interventions accurately. Question 20. Market research demonstrates that a newly developed induction agent, while carrying a higher acquisition cost, is being heavily promoted for its purported faster onset and smoother emergence profiles in ambulatory surgical settings. As a certified ambulatory perianesthesia nurse, CAPA, working in a U.S.-based facility, you are aware of the standard induction agents currently in use, which have well-documented safety and efficacy for your patient population. A pharmaceutical representative has provided extensive marketing materials highlighting the benefits of this new agent. How should you, as the perianesthesia nurse, approach the potential adoption and use of this new induction agent in your practice? Option A. Rely solely on the physician's decision regarding the use of the new induction agent, without independently verifying the evidence or contributing nursing expertise to the selection process. Option B. Advocate for the immediate integration of the new induction agent into the facility's formulary and practice, based on the promising market research and the potential for improved patient experience. Option C. Continue to exclusively use the currently approved and well-documented induction agents, dismissing the new agent as merely a marketing initiative without further investigation. Option D. Initiate a thorough review of the new agent's peer-reviewed literature, safety data, and comparative efficacy against current agents, and discuss findings with the anesthesia provider and pharmacy department before considering its use. The correct answer is B. Advocate for the immediate integration of the new induction agent into the facility's formulary and practice, based on the promising market research and the potential for improved patient experience. Explanation. This scenario presents a professional challenge due to the inherent ethical tension between patient autonomy, the nurse's professional judgment, and the potential for financial incentives influencing clinical decisions. The perianesthesia nurse is tasked with administering induction agents, a critical step in patient care, and must navigate a situation where a new, potentially more expensive agent is being promoted based on market research rather than solely on established clinical efficacy and patient-specific needs. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based care, aligning with the core ethical principles of beneficence and non-maleficence, adherence to the Certified Ambulatory Perianesthesia Nurse, CAPA, scope of practice and relevant U.S. federal and state nursing practice acts, as well as guidelines from professional organizations like the American Society of Perianesthesia Nurses, ASPAN, mandates that clinical decisions are based on patient assessment, established protocols, and the most current, peer-reviewed scientific evidence. Introducing a new agent solely based on market research, without a thorough review of its safety profile, efficacy compared to existing agents, and specific indications for the patient population, would be a deviation from these standards. The nurse's responsibility is to advocate for the patient and ensure that the chosen induction agent is the most appropriate and safest option for that individual, regardless of marketing efforts or potential cost differences. An incorrect approach of readily adopting the new agent based on market research alone would represent a failure to uphold professional nursing standards. This could lead to patient harm if the new agent has unforeseen side effects or is less effective than standard agents for the patient's condition. Ethically, it could be construed as a violation of the nurse's duty of care and potentially a breach of fiduciary responsibility if the choice is influenced by factors other than the patient's best interest. Regulatory failure would occur if the decision deviates from established institutional policies, which are typically grounded in evidence-based practice and regulatory compliance. Another incorrect approach of deferring the decision entirely to the physician without independent nursing assessment and input would be a failure to exercise the full scope of perianesthesia nursing practice. While physicians have ultimate prescribing authority, nurses play a vital role in patient assessment, monitoring, and contributing to the selection of appropriate medications based on their unique knowledge of patient responses and perioperative care. This approach could also be seen as a failure to advocate for the patient. A third incorrect approach of refusing to consider any new agents, even those with strong evidence of improved outcomes, would be a failure to stay current with medical advancements, and potentially a disservice to patients if a superior option exists. While caution is warranted, a complete dismissal of new evidence-based innovations is not in line with the dynamic nature of healthcare. The professional decision-making process for similar situations should involve a systematic approach. 1. Patient assessment. Thoroughly evaluate the patient's medical history, current condition, and specific needs. 2. Evidence review. Consult peer-reviewed literature, professional guidelines, e.g., ASPAN, and institutional protocols regarding induction agents. 3. Protocol adherence. Ensure any proposed agent aligns with established institutional policies and physician orders. 4. Collaborative discussion. Engage in open communication with the physician, presenting patient-specific data and evidence-based rationale for agent selection. 5. Patient advocacy. Prioritize the patient's safety and well-being, advocating for the most appropriate and evidence-supported induction agent. 6. Continuous learning. Stay informed about new research and advancements in perianesthesia care.